Hello everyone, welcome to our class. And my name is Chen Yan. I come from Zhejiang Provincial Hospital, and my major is endocrinology. In this lesson, we will learn about the medical interview together. As we know, communication is the heart of patient care, and good communication is difficult because few people can master it without special tuition or constant attention to its effectiveness. So it's natural to introduce a question to us: how to become a good doctor? I think if you want to be a good physician, you must have 5 personalities at the same time. First of all, a good physician must be a careful observer so that the information provided by the patient can be fully collected. Secondly, a good physician must be humble and easy to learn, and live with the mentality of a student until he learns, so that he can constantly update his knowledge system. Third, a good physician must be able to make judgments accurately and timely, so as not to delay the patient's condition. Fourth, a good physician also needs to have critical thinking, so as to judge dialectically whether the information provided by the patient is correct. And finally, a good physician must also be a successful communication expert, so that patients can naturally provide all the information, and the patients can trust and make the subsequent diagnosis and treatment smooth. So, we can judge the importance and skill of the medical interview from this PPT. In this lesson, we will learn the communication to win. And the aim of this lesson is to help you to develop the skills that will enable you to communicate effectively and sensitively with patients and their relatives and with your colleagues. We will talk about the importance of medical interview. First, the medical interview can provide us the data for making diagnosis. And second, it's the core for physical, lab, and other examination. The third, it can provide the patient to the doctor relationship. And it can provide biopsychosocial medical approach. So, we call the medical interview as the first step to treat patients. The main purpose of medical interview is to obtain basic information related to the patient's illness or reason for visit, and is to make the diagnosis accurately. So, I think the communication is the interviewer's skill which can establish trust between patients and doctors, and the doctors should ask questions understandable to patients and act as an interpreter if necessary. So, now there is a question: how to be a wonderful interviewer? First, the doctor should be cheerful, friendly, but respectful, and genuinely concerned about the patient. And the second, the doctors should have to gain experience asking questions about subjects that are more painful, delicate, or unpleasant. Now, let me show you some pictures which can provide body language for nonverbal clues. The picture in the upper left-hand corner reminds a man with a set face and a big mouth shouting, which shows the pain. The picture in the upper right corner hints at a man covering his mouth with his hand, which shows the coughing. The picture in the lower left corner prompts a patient to scratch his skin with his hand, suggesting itching. And the picture in the lower right corner prompts a patient who wants to pass an empty glass for drink water, indicating that he is thirsty. Now, let me show you something. Okay, let's take a look at this slide. Before the answer is displayed, please think about what symptoms different body language may suggest. First, the picture in the upper left corner reminds a man with a sad face covering his cheeks with his hands, which shows the toothache. And the second, the picture in the upper right corner reminds a man who is twisting his body using hands to sound or massage his waist, suggesting lumbar. The third, the picture in the lower left corner prompts a patient crouching on the ground with hands covering her upper abdomen, suggesting stomachache. And the last, the picture in the lower right corner prompts a patient covering his chest in pain, indicating that he has chest pain or shortness of breath. Okay, there are something to must be patient too. The first, please listen without interruption. It's important and it requires skills. If you interrupt the patient, you can disrupt the patient's train of thought. And please permit patients to express themselves in their own words. There is still another skill in communication, that is using open questions. And this skill, that is using open questions in communication, leads to more valuable information. At first, let's understand what is an open question. Open question is a question which cannot be answered with 1 or 2 words, and this kind of question needs explanation. For example, you can ask the patient, could you please tell me what problem brought you to hospital? Or, why have you come to see the doctor today? There is still another skill in communication, that is using open questions. And this skill, that is using open questions in communication, leads to more valuable information. At first, let's understand what is an open question. Okay, let's look at this slide. I think basic principles of medical interview can be summarized in 5 words. That is, audition, evaluation, inquiry, observation, and understanding. First, audition means listening carefully, and evaluation is sort out relevant from irrelevant data. And the third, inquiry means probing into significant area requiring more clarification. And the fourth, the observation is very important in nonverbal communication, and it's regardless of what is said. And last is understanding. Understanding is of patient concerns and apprehensions. Please remember to play empathetic role. In summary, we can remember these 5 words through AEIOU to remember the basic principles of medical interview. There are 3 phrases to remember the basic principles of medical interview. That is, listen more, talk less, and interrupt infrequently. At the beginning of the interview, we should establish a report. The aim of establishing a report is to explain the purpose of the interview, is to indicate the time available, and is to help the patient to tell his or her story as fully and accurately as possible. In the last slide, we have talked about the aim of the beginning of the interview, that is to help the patient to tell the story as fully and accurately as possible. So we should do three things. The first is to provide a comfortable setting, and the second is to explain the purpose of the interview, and the third, please indicate the time available. Okay, let's look at a few examples. The first example, Dr. Buck. Hello, Mr. Brown. I'm sorry to interrupt you, but I'm Dan Buck, one of the students attached to Mr. Morrison's firm. I have been asked to come and talk to you about the problem that brought you into hospital, so that I can tell Dr. Morrison about you when he does his ward round later this week. I can spend about 40 minutes talking with you. Is that all right? Mr. Brown. Yes, sure. Go ahead. Dr. Buck. Well, I'd love to take some notes so that I can write up your history later. How do you feel about that? Mr. Brown. That's fine by me. In this dialogue, we noticed that at the beginning of the meeting, we should use the former name to call the patients and ourselves, and we should demonstrate the time required. And if we need to make some notes, please don't forget to solicit patients' opinions. Okay, let's look at. We often say that we can take a history from the patient. It's an expression that implies that the process flows in one direction. The direction is from the patient to doctor. But we have seen that what the doctor does influences how patients divulge their problems. For example, the body language, the manner of questioning and listening of the doctor influence how patients divulge their problems. So, the key point of taking a medical history is how to make the diagnosis correct. The doctors should learn to receive, not to take, a medical history. Please remember that you will obtain a more accurate and relevant history of the patient's problems if you develop good communication skills. In the previous lesson, we have learned skills of medical interview. In the following lessons, we will explain the medical interview based on these chapters. Okay, let's go into the details of the structure of the medical history. The structure of the medical history includes 8 parts. The first is basic information about the patient. The second is description of presenting problem. The third is history of presenting problems. And the fourth is review of body system. The fifth is past medical history. The sixth is personal history. The seventh is family history. And the last part is social history. Next, we will introduce them one by one. This picture is the structure of an admission record. And this picture is also the structure of an admission record. Information about the patient includes the patient's name, address, age, occupation, and marital status. You should try to find out the patient's name before the interview. If not, ask the patient his or her name and how he or she wishes to be added. You may choose together the rest of the information during the course of the interview, which avoids beginning by asking the patient a list of questions. Okay, let's go to the description of presenting problem. It refers to recent changes in health that led the patient to seek medical attention at this time, and it describes the information relevant to the chief complaint. We should use chronological order to organize history, and please be very thorough. Sometimes a patient provides a diagnosis rather than a symptom. When this happens, it's important to ask the patient what he or she is experiencing. Please don't be put off if the patient provides a diagnosis you have never heard of.
Let's see the description of presenting problem. It refers to recent changes in health that led the patient to seek medical attention at this time. And the description of presenting problem describes the information relevant to the chief complaint. Please use chronological order to organize history, and please be very thorough. Sometimes a patient provides a diagnosis rather than a symptom. When this happens, it's important to ask the patient what he or she is experiencing. And please don't be put off if the patient provides a diagnosis you have never heard of. For example, the patient said, "I have ocular range web disease." The student should say, "I'm afraid I don't know much about your disease yet. Perhaps you could tell me about how it troubles you." Patients may well not only describe their problems, but also tell you about their condition. Please remember that patients can teach us a great deal. It's important to acknowledge and respond to these emotions before continuing, even if it's decided to deal with the issues later on in the interview. For example, the patient said, "I felt so awful that I thought I was going to die." The student should say, "That must have been very frightening. Do you want to talk about it now, or shall we go on and talk about it later?" And please ask the patient if he or she has any other problems. It's often easier to identify all the patient's problems before obtaining more information about the presenting complaint. For example, Dr. Lee said, "You have told me that you have trouble passing the water. Before you discuss that further, could you tell me if you have any other problems?" Mr. Brown said, "Yes, I have been a bit of unsteady on my feet recently, and a bit of short of breath when climbing stairs, and I'm worried about my wife who has just had a stroke."
Let's talk about the history of presenting problems. The aims of the history of presenting problem is to obtain a detailed history that is complete, accurate, and relevant, and is to find out the patient's perception of what is wrong, and is to establish the patient's attitudes to the problem, and is to determine what effect the problem has on the patient's day-to-day life and relationships. There are 6 questions which can be used to take a history of the patient's presenting problem. The first is who is affected by it. The second is how bad is it, and how is it affected by. The third is where, it can show me where it is. The fourth is why do you think you have got it? The fifth is when did it start, when does it occur, how often, how long for. And the sixth is what does it feel like, what brings it on, and what else. Taking a history of the patient's presenting problem is to look at the procedure in more details. We should consider the questions that should be asked of the patient complaining of pain. Sometimes it's helpful to ask the patient to recall the onset of the problem and describe how it has developed since then. If there have been numerous different episodes, please ask the patient to describe the typical one. So, when we talk about the timing, we can use the following questions. When did the pain begin? How did it start? Its duration. How often does it occur? How did it end? Let's look at this example. Dr. Buck. How long does the pain last? Mr. Brown. Just a short while. Dr. Buck. A minute? 5 minutes? Half an hour? Mr. Brown. Oh, not half an hour. Mr. Buck. How long then? Mr. Brown. About 10 minutes. Let's look at this example. The question about where is to describe the location and radiation of the symptoms. Please ask the patient to point to the site of the problem, and please find out if the pain radiates, and if so, where the pain spreads to. So, for example, if it is abdominal pain, you need to know the exact position in order to make the diagnosis. A person with gallbladder disease may experience the pain in the upper abdomen and in the right shoulder, and someone with a slipped disc may have back pain that spreads down the leg. So, for example, if it is abdominal pain, you need to know the exact position in order to make the diagnosis. The question about the quality is what is it like, and the symptoms vary in quality. The type of pain is important in different diagnoses. Pain may be described as sharp, dull, tight, throbbing, constant, or comes and goes. You can see a patient with pleurisy will usually complain of chest pain that is sharp when breathing in, whereas someone who has had a heart attack will usually complain of constant, tight, gripping pain in the chest.
In this slide, we will talk about how to discuss the severity, and that is how bad is it. From the pain level map, there are 6 levels about the pain level. That is painless, slight, mild, moderate, severe, and extremely severe. We can ask patients to relate the severity of their present pain to a previous experience. For example, Dr. Brown said the pain was pretty awful. Dr. Buck said, would you say it's the worst pain you have ever had? Mr. Brown said, well, I had pain in my leg when I had sciatica, but this was far worse than that.
The examination about the setting. Dr. Buck said, you have told me a lot about your abdominal pain and the way it's associated with wind and problems in passing your motions. Could you tell me now about what you are usually doing when the pain comes on? Mr. Brown said, I've been thinking about that. I never get this problem when I am on holiday. It seems to happen mostly when I'm busy at work or when we are expecting visitors at home. Okay, this slide is about the modifying factors. We should find out what makes the symptoms worse and what makes them better. And the best way to obtain a history of the presenting complaint is to start with an open question. Note which aspects of the problem the patient describes spontaneously, and then fill in the gaps with closed or probing questions. And you may find this difficult to do initially, but it's a skill that comes with practice. For example, Dr. Buck said, when you have the pain, is there anything that makes it better? Mr. Brown said, it's better when I have passed wind or had my bowels open. Dr. Buck said, how does what you have ate affect it? Mr. Brown said, I used to eat lots of vegetables and fruit, but I have cut that down and the pain seems to be a bit better. Dr. Buck said, do you ever take any medicine for the pain? Mr. Brown said, no, I tried paracetamol once, but that didn't seem to make any difference. So what effect does it have on the patient's quality of life? You may have found out a lot about the impact of the problem on the patient's life from the patient's answers to your previous questions. The doctor should look especially at the effect on mood and relationship and job and leisure and social life, sexual and social life. Another example about the effect which has on the patient's quality of life. Okay, let's look at this example. Here is another example about the effect which has on the patient's quality of life. And what's the patient's understanding of the problem? We could try to explore what the problem means for the patient, what the patient thinks it might be caused by or related to. And it's important to get an understanding of patient's concerns and how they interpret their symptoms so that you can provide explanations and advice appropriate to their needs. This may be particularly important when a patient has a different cultural background to your own. And at this stage, try to summarize what the patient has told you about the present problem so that the patient can check the accuracy and filling any gaps. So it's an example about the patient understanding of the problem. Perhaps you could tell me what you think is causing your problem, and we can ask the patient what concerns you most about your problem. Okay, let's go to the review of body systems. This section of the interview involves a series of questions related to each of the body systems. The purpose is to elicit important symptoms that the patient may have forgotten or may not have considered significant because they were not related to their presenting complaint. Okay, this picture showed me 6 systems about the system review. About the cardiovascular system review, we can ask patients about the following questions. First, could you tell me if you have any trouble with your heart? And the second, what about chest pain or palpitations? The third, do your ankles ever swell? About the respiratory system review, we can ask patients about the following questions. The first question, do you have any problem with your lungs, like shortness of breath or coughing? The second, is sputum present? The third, what color is it? The fourth, have you ever seen blood in it? About the respiratory system review, we can ask patients about the following questions. The system review about the genitourinary, we can ask the following questions. Do you ever have any problems passing water? What about pain when you pass it? Does your urine have an unusual color or smell? Is the system review about the mental state? By carrying out a brief assessment of the patient's mental state, you can identify cognitive problems. A brief account suitable for routine use will be given here. More detailed descriptions of assessment that should be followed if a psychiatric disorder is suspected are given in textbooks of psychiatry. Go to the past medical history, and the past medical history includes general state of health, past illness, past physical history and accidents and injuries history, and vaccinations and allergy history. In slides, we also talk about the past medical history. Please pay attention what items in the past medical history we should ask the patient. The patient is an adult. Please ask him whether significant illnesses or conditions they have had. When you talk to the patient, please pay attention to the time of onset or date of diagnosis, and please pay attention to the control of disease or condition, and if any, please pay attention to his treatment. Past medical history also includes the accidents or injuries, including fractures. When the patient talks about the accidents or injuries, please note data and complications if any. And if injury required surgical intervention, it can describe it in detail here. If injury required surgical intervention, it can describe it in detail here. When we talk about the injury and talk about the accident, get details about accident. For example, the passenger or the driver, the restrained or the unrestrained, the fractures, and so on. After medical history, please ask about any significant care or other hospitalizations not covered, and please ask about toxins and or industrial exposure. Please ask tactfully about any psychiatric history or hospitalization. If the patient had multiple surgeries, please make a separate category. It will be very helpful. Talk about the past surgical history. Please note the reason for the surgery, if not obvious. Please note any complications, and please use chronological order and numbers, or use a separate paragraph if more than one surgical procedure. So you can look at the example with the blue words. If this is another example for the past surgical history, you can read it in details. Medical history, the patient should be asked about the preventive health. Preventive health is the current immunization status, and this status will depend on age of patient and associated conditions. For example, the tetanus and the bacillus calmette should be paid attention to. The allergy history is included in the past history. And what about the allergy? We should describe not only what the patient is allergic to, but also the manifestation of that allergy. In the lower picture is the manifestation of allergy, including vomiting, stomachache, asthma, redness, rash, and itching. Let's go to the lifestyle, the smoking history. In this part, we should ask the patient about the following questions. Do you smoke? What do you smoke? How much do you smoke? How long have you smoked like this? And if the patient is a non-smoker, ask if the patient smoked in the past, and if so, for how long? And in the last line, please remember the record mode. Okay, we will talk about the lifestyle of drinking history. In this part, we should make the details of alcohol consumption. Please ask what and how much during an average week, and please record alcohol consumption in number of units per week. Let's go to the part of lifestyle of drug history. This part includes all current drugs prescribed by a doctor, and all drugs that the patient has bought over the counter, and recreational drugs if used. In this slide is the lifestyle of sources of stress. For example, we can ask the patient, could you tell me if you feel particularly stressed, and what sort of things cause you stress? This slide, we should also talk about the family history. In this part, we should ask about the ages, the state of health of the family, and we should summarize them. Please ask the age and cause of death of the family members, including the parents, the siblings, the spouse, and children. And we should inquire about any similar symptoms or signs in family members if patients present with inheritable symptoms or signs. When we talk about the social history, the following questions should be paid attention to. The first question is, how does the patient spend an average day? The second question is, what is the structure of the patient's family, and how do the members relate to each other? The third question is, what is the patient's lifestyle? And the fourth question is, does the patient have any worries about finance, academician, and so on? And here we have talked about all parts of the medical interview, and the following slide is about some practical hints for taking a history. For example, we should take every opportunity to interview patients, and please be prepared to spend time with patients. We can use the skills of communication, and please make rough notes and write them down up later. There are also common concerns about interviewing patients. We can talk about it in the following slides. For example, if the doctors forget what question to ask next, you can summarize what the patient has told you so far, and please bring a notebook. The patient asked me a question about his or her condition. The general rule is we should not answer questions that patients may ask you about their condition, but suggest that they may ask their doctor. The patient starts crying or becoming emotional. How could we do? We should control our anxiety and avoid rushing in with questions and give the patient an opportunity to express emotion. That's all for this class, and we could summarize the key points of this class. It's important. I'm saying it's important to obtain a complete and accurate history, and for the majority of patients, the diagnosis can be made on the history alone. Okay, this slide shows us the key points of this class. Good communication skills are essential, and please use open questions and listen carefully and keep up and respond to verbal and non-verbal clues.